Welcome to The Explainer. Today, we're going to dive deep into ADHD. But we're not just talking about a disorder. We're looking at it as a journey to understand and manage a unique way of thinking and being.
So let's just start with this question. Imagine, just for a second, that your brain is constantly buzzing, always on the move, never ever finding that quiet off switch. For millions of people, that's not just a thought experiment. It's the day in, day out reality of living with ADHD.
And this is what it actually feels like. These aren't just excuses or, character flaws. This is the real life experience. It's that constant, nagging feeling of being unable to focus, of your body needing to move, of words just tumbling out. It's the daily challenge of living in a world that isn't always set up for a brain that's wired this way.
Okay, so to really get our arms around this, we need to start with the basics. Let's get a crystal clear picture of what we're actually talking about.
So here's the official definition, and a couple of words here are absolutely key. First, neurodevelopmental. That means it starts in the brain's development. It's not a choice or a bad habit. And then you have the big three: inattention, hyperactivity, and impulsivity. But here's the real kicker. For it to be ADHD, these patterns have to be persistent and they have to get in the way of everyday life.
So the next big question is, why? Where does this come from? It is so important to understand that this is not caused by lazy parenting or too much sugar or video games. The real story is way more scientific and honestly, way more interesting.
The truth is, there's no single cause. It's more like a recipe with a few major ingredients. Genetics is the biggest one. It absolutely runs in families. Then there's neurobiology, which is just a fancy way of saying there are real, measurable differences in brain structure and chemistry. Throw in some potential factors from before birth and in the environment, and you start to see it's a complex puzzle.
All right, so if we know what it is and we have an idea of where it comes from, what's next? Well, before you can manage anything, you need a map. And that map gets created through a really thorough, comprehensive assessment.
And let me tell you, a proper diagnosis is not a quick checklist. It is some serious detective work. Professionals gather information from everybody, the child, parents, teachers, to see the whole picture. They use standardized scales to be objective, and they do a full physical exam to make sure nothing else is going on. It's all about getting a 360-degree view of that person's world.
And this right here, this is where the magic happens. It's a total shift in thinking. A diagnosis isn't the end of the story. It's the beginning of a plan. Look at how a clinical-sounding problem like risk for injury gets flipped into a positive active goal. Promote safety. We're moving from just identifying a challenge to paving a path forward.
Which brings us to the really practical part of this journey. The how. How do you actually manage ADHD day to day? Well, there's no single magic wand. Instead, it's all about having a well-stocked toolkit.
And here it is. This toolkit is so versatile. You've got tools for changing the environment, like creating predictable routines. You have tools for teaching new skills, like using checklists or calendars. And you have tools for building a strong team, like getting parents and schools on the same page. It's all about finding the right combination for each unique person. I want to pause on this one, because it is foundational. It's a game changer. For a mind that can feel like a whirlwind on the inside, creating structure on the outside is just incredibly powerful. Predictable routines and clear rules act like an external set of brakes and a steering wheel for the brain. It provides the calm that can be so hard to find internally.
And remember, this is a team sport. It is so crucial to understand that management isn't just about the child. When the entire family learns and gets support, it's like a weight is lifted. The stigma goes down, caregiver stress goes down, and the home becomes a place of understanding and support. A supported family creates a supportive home. Simple as that.
So, you've put the toolkit to work. How do you know if you're winning? What does success actually look like on this new path? Let's take a look at how we can see the progress.
Here it is, the payoff. You can draw a straight line from the challenge to the outcome. We start with inattention, and we get to improved focus. We start with impulsive actions, and we get to a child who is safer. These aren't just words on a chart. This is a kid who feels more confident, who is having an easier time with friends,
and a family that feels more connected and less stressed. And this, right here, might be the most important takeaway of all. The goal is not to cure ADHD. It's not about erasing a part of someone's personality. It's about empowerment. It's about giving them the skills and the support they need to navigate the world successfully, to reach their incredible potential, and just have a better quality of life.
So I'll leave you with this final thought. Understanding this journey isn't just for those who are directly affected. It's a question for all of us. How can we, in our schools, in our workplaces, in our communities, help build a world that is more patient, more understanding, and more supportive of minds that are simply wired differently? Thank you for joining me on The Explainer.